The history of Casa Colina is defined by transformation, from a grassroots community home to a sophisticated physician-led specialty hospital. Founded in 1936 by Frances Eleanor Smith, Casa Colina began as a haven for children battling polio and other disabling conditions. When the polio vaccine was introduced in the mid-1950s, Casa Colina evolved, expanding its expertise and redefining rehabilitation care to remain at the forefront of medicine. In 1973, Dr. Dale Ezell was named president and CEO, ushering in a transformative era. As rehabilitation services expanded across the United States, Casa Colina became a pioneer in innovative programs for individuals living with disabilities. Under his team's leadership, the organization launched hallmark services, including the Children's Services Center, the Transitional Living Center, Rancho Pino Verde, the Adult Day Healthcare Center, Padua Village Residential Program, and the Wheelchair Sports Program, now known as Outdoor Adventures. This period of program growth and campus expansion reflected Casa Colina's holistic philosophy, a commitment not only to medical recovery, but to restoring independence, function, and quality of life through highly individualized care. In the 1970s, Casa Colina broke new ground with its Wheelchair Sports Program. The program sponsored an elite athletic team, the California Condors, and demonstrated the life-affirming power of sports in rehabilitation.
The talent these guys have. And that's the ball game.
It's all over.
Casa Colina with their 7th national championship.
Through competition, teamwork, and community, patients rediscovered strength, confidence, and identity beyond their injuries.
I was director of wheelchair sports for 17 years at Casa Colina, and we began with the typical sports: wheelchair basketball, wheelchair tennis, wheelchair track and field. But I began to schedule adaptive ski trips and whitewater rafting trips. And those are the activities that really get families into life together, regardless of their loved one's injury or disability. So it makes perfect sense that Casa Colina went down that road. And mind you, they went down that road first.
Over time, the Wheelchair Sports Program evolved into Outdoor Adventures, expanding opportunities beyond elite athletes to include recreational experiences, team-building activities, and life-enriching outdoor programs for individuals of all ability levels. In 1980, Casa Colina pioneered another groundbreaking program, the Transitional Living Center, or TLC. Developed to bridge a critical gap in recovery for adults with brain and spinal cord injuries, TLC was designed as a step between acute inpatient rehabilitation and returning home. It provided a structured, supportive, therapeutic environment where individuals could continue rebuilding independence while still benefiting from professional oversight. At TLC, the focus extends beyond traditional medical treatment. The emphasis is on real-world skills, confidence building, and preparing individuals for meaningful participation in family and community life.
I'm a firefighter paramedic for the Los Angeles Fire Department. April 23rd, a trash truck ran the light and broadsided me on my side of the ambulance.
Once we were able to meet with Dr. Patterson and he evaluated Ira, he confirmed that Ira had a traumatic brain injury.
And what Casa Colina did for me was
they gave us hope.
they restored my life. They restored my life so I can finish being a firefighter paramedic, which I love to do. So they helped me get back to my job. They gave me a second chance and make me a better person.
In 1988, Casa Colina welcomed Dr. Felice Laverso as president and CEO. Over the next 25 years, Dr. Loverso transformed the organization into a nationally recognized leader in medical rehabilitation. Under his leadership, Casa Colina's growing team of experts refocused on acute hospital-based care and led the rebuilding of the Pomona campus, including construction of a new hospital, a medical surgical wing, and expanded specialty clinics and outpatient programs. Research long valued at Casa Colina became a central pillar of the mission. Dr. Loverso championed the creation of a dedicated research institute, elevating the organization's commitment to advancing rehabilitation science. At the same time, he was deeply committed to recruiting the very best physicians to Casa Colina's community to lead highly specialized, physician-driven programs. Through strategic partnerships with leading academic institutions, he built strong clinical bridges that expanded access to expert care. As a result of these physician relationships, many patients came to Casa Colina specifically seeking the advanced programs and trusted specialists he helped bring to its campus.
So I was injured November 2nd, 2008. I was riding my motorcycle, and so that's how I got a traumatic brain injury.
He was taken to UCLA by helicopter, and at that time he couldn't walk and he couldn't talk. And luckily, his neurosurgeon was the one that told me about Casa Colina. And that's really where his recovery started, once he got in the hands of Dr. Patterson.
I got physical therapy, occupational therapy, and it took a long time, but I recall feeling safe at Casa Colina.
And having that touchstone with Casa Colina, it's hard for me to express what a savior it's been to me and to Marco.
Casa Colina's history is marked by resilience, expansion, and an unwavering commitment to community. In the early 2000s, as wars in Afghanistan and Iraq brought wounded service members home, many faced catastrophic traumatic brain injuries caused by blast exposure and battlefield trauma. Casa Colina responded by focusing its expertise on neurological rehabilitation to serve military personnel in need. Expanding its mission, Casa Colina partnered with TRICARE, the health program serving uniformed service members, and worked alongside the Department of Defense and Veterans Affairs systems. Together, they helped inform and elevate standards of care for warriors with traumatic brain injury. This work gained national recognition and brought attention beyond Southern California, earning congressional certificates of recognition for continuous service to veterans and military families.
I was in Iraq in July 2007, and I got a penetrating traumatic brain injury. The bullet went right into my brain, and my soldier saved me, and I'm still alive.
It was a total catastrophic injury, and the physicians told us he probably most likely would never speak again. But I felt if we gave him the right therapy, and thankfully with Casa Colina's help, we have.
They really cared about people for PT, OT, speech, everything. It was great. It was really great. It's just incredible. Every time I think about it, I just love that place. This is 14 years later, but I always just say, I'm always like, say thank you to Casa Colina, because they were that good.
For 90 years, Casa Colina has been dedicated to clinical excellence grounded in compassion and innovation. Casa Colina's journey reflects a powerful truth. Recovery is not measured solely by medical outcomes, but by a person's ability to reclaim purpose, independence, and meaningful participation in life.